We are back now with Dr. John Kressel of Phoenix Cyberknife, and we are talking about cancer treatment on this World Cancer Day. Good to see you back again. You were mentioning about this big study that was done on lung cancer treatment. Tell us about those results.
Well, it's a large study that compared surgery versus Cyberknife radiosurgery, so something that's invasive and cutting versus something that's done as an outpatient for early stage lung cancer. It was published last year in Lancet, one of the big medical journals, and it basically showed that radiosurgery, so not having to go through surgery in the proper patients, was at least equal to, if not better than surgery for survival, cure, and reduced side effects.
So when you use that term radiosurgery, for people out there that may go right over their head, what is that specifically?
So this is a very precise, very accurate radiation therapy. So it's treatment delivered from outside the body to inside the body with no incision, no cutting. So very precise, radiation beams targeted just on the tumor.
Right, and it really essentially does not affect the tissue around the area that you're treating.
That's the goal, and Cyberknife is unique in that it's the only treatment that actually moves with the patient's breathing, so that allows us to target the tumor and minimize the amount of damage to surrounding normal tissue by moving the radiation beam with the target, because patients have to breathe.
And we talked to one of your patients earlier this week, and he did not have lung cancer. He was dealing with prostate cancer, but tell us about his case.
So this is a physician who has early stage prostate cancer, and he was evaluating his treatment options and really wasn't satisfied with what he was hearing from some physicians and wanted to learn more about what Cyberknife was for an option. Got to our center, had a chance to sit down with him, show him all of the data. He elected to proceed with Cyberknife treatment.
All right, let's hear directly from that patient now.
The thing that drove me more to Cyberknife was the fact that it's a short course of treatment. 5 treatments in the course of a week, and you're done. Whereas standard radiation therapy, there are several types, but the more commonly used one is 5 treatments a week.
And Dr. Delucci shared with me that he does his frequent, yearly checkups. He's very on top of it. He's a doctor, so he wants to make sure that his health is optimal, and he went for a PSA, and the PSA level was a little elevated. How is he doing today?
So I'm glad to say that today he has no evidence of disease. His PSA is essentially, reduced to the point of not having any malignancy, any cancer.
Wow, I mean, you gotta just, does it blow your mind sometimes to see the success rate of some of these patients? Well,
it's very gratifying. I mean, I've been in the care of taking care of oncology patients for years, but to have these new tools, because radiosurgery is something that is relatively new, and not everybody can do it, not everybody's trained in it, but it certainly is the state of the art for a number of different disease sites, and prostate cancer is one, lungs another, and there's many. So learning if that's an option for you as an individual patient or someone that you love, I think is important.
And who's the best candidate for radiosurgery?
So typically the best candidates are those that are early stage, or those that have symptoms from their cancer, if it's causing problems, depending on if it's the brain, spine, other parts of the body with pain or problems.
All right, well, Dr. Kressel, as always, thank you so much for your insight. And if you have questions for Phoenix Cyberknife Radiation Oncology, we encourage you to email them, info@pcroc.com. They're located at 4611 East Shea Boulevard in Phoenix. Call 602-497-0605. That's the number to book an appointment, or visit them online, phoenixcyberknifecenter.com.